Good afternoon, everybody. It is midday and you are all very, very welcome to the first of these 3 events being held by the National Guardian's Office during Speak Up Month this October. So thank you so much to everybody for joining us. I'm Sara Gorton. I'm the head of health at the trade union Unison, and I chair the staff side of the Social Partnership Forum for the NHS. And I'm hugely honoured to be asked to host this conversation today, which I hope will be of interest to all of you. It's a really important chance to hear from 3 Freedom to Speak Up Guardians about the important work that the Guardians do. And I will ask the panelists to introduce themselves to you in a couple of minutes. But first, while everybody is logging onto the call, just to do a few housekeeping notices. You can see that there's a housekeeping slide with all of the technical details that you need that comes up periodically. So if you have any problems, if you can follow the advice that's set out there and call that phone line if you can't hear the speakers and can't resolve any technical issues yourself. So that's 0207 448 9469. So housekeeping wise, it would help us enormously with the bandwidth. We are hoping that we do not have any technical issues, but it would help us if you are not one of our panelists, if you could keep your microphone off so that the sound isn't interrupted, and also keep your camera off so that we've got enough bandwidth so that we can see all of our speakers today. As you will hopefully have seen when you had the consent notice at the start of the meeting, today's session is going to be recorded. So we've got a lot of you on the call today, but we want to reach an even wider audience. So we're going to be recording and sharing the conversation. So just to be sure that you know that that is going to happen. In terms of timing, we need to finish promptly at 1 o'clock today. So you'll all be released back into the wild, or for those of you lucky enough to get a lunch break, back to your lunch break at 1 o'clock. In terms of the format today, I'm hoping that we're able to run this as a good structured conversation, informed by any burning issues that you as the audience want to raise during the course of the session. So I've got some questions that I've prepared for the panel around 3 broad themes that I'll go through, but we do have the chat box available. And if you can use that chat box, if there are any burning questions that you wish me to put to the panelists as we go through, any key observations you want to make on the theme, that would be great. If we could make sure that we're respectful in the way we use the chat box to, so that we can focus on the one conversation that we're having rather than having rival discussions going on in the chat box, that would help me as chair, so that I can monitor it. And thank you in advance to the staff of the National Guardian's Office, who are both doing all of the technical duties to make the session happen today. But Catherine, I know you're also on hand to let me know if there's anything timing wise that we need to pay attention to, or issues in the chat that I need to bring up. So without further ado, I'm going to hand over now to our 3 panelists today to introduce themselves to you before we kick off what I hope is going to be a really lively and informative conversation. So Celina, if I could turn to you first, and then you can pass on to your fellow panelists.
Hi, good afternoon, everyone. Really good to be on this platform. My name is Celina Mfuko. I'm a Freedom to Speak Up Guardian for East and North Hearts, NHS Trust, as well as Equality, Diversity and Inclusion Lead. And I'll stop there.
Fantastic. Thank you, Celina. And Helen.
Hi, thank you for having me today. It's an honour. I'm Helen Turner and I'm the Freedom to Speak Up lead at Shrewsbury and Telford Hospital.
You're both very welcome and joyful.
Good afternoon, everybody. My name is Joyful Chigiga. I'm a maternity investigator with the HSIB, which is the Healthcare and Safety Investigation Branch. I am home-based. Our head office is in Farnborough, and I'm a Freedom to Speak Up Guardians for the organization.
Wonderful. Thank you all very much. So a lot of the people on the call may be guardians themselves, they may have had contact with guardians, but we're also hoping to reach people who so far have not had any contact with the guardians in any way. So Joyful, could I turn to you first, and can you kick us off by just briefly describing the role of the guardian and how health workers can find out if they have one and how they can get in touch?
Thank you, Sarah. As a guardian, our main role is to support staff to speak up to us regarding anything, any concern they might have. Normally, if they feel unable to speak to either, maybe they might have tried all the different routes of approaching their line manager, or they've gone through all the different steps and they feel their concern hasn't reached the outcome maybe they were expecting. So we always invite anybody to come and speak to us. We provide a one-to-one approach. That's what we do, a one-to-one conversation, or it could be anybody within a group can just approach a guardian. We offer a non-judgmental conversation where we thank you and we listen to the concern to try and get some clarity. So where we can differentiate what are the facts and what are the emotions and what are the feelings, because at times when you've got a concern, there is those things which can mirror the whole concern you've got. And our role as well is to support an organization in becoming an open and transparent place to work, where all staff are actively encouraged and enabled to speak up safely. Where you can find your guardian, I would sort of like just for today, I will guide you to just go through to the National Guidance Office website, because they've got a lovely map where it's got everybody, all the guardians within England. Then you can spot which guardians you want to use, but no, you can also use your organization's website. They should have a web page where you can locate your guardians. That's me done. I'll pass it back to Sarah. Thank you.
Thank you, Joyful. And Helen, next question is for you. And I guess a lot of people who have heard of the Freedom to Speak Up Guardians probably associate it most with patient safety issues, but that's not the whole scope of the role. Could you just give people watching a bit of a flavour just of the kind of the range of issues that are brought to you as guardians?
Yeah, sure. So no, absolutely not. Behaviours and attitudes and behaviours, bullying and harassment, they're the big ones. We get some sort of staff safety issues through, and that really rose through the pandemic, and we can talk about that a little bit later on. We get about policies, procedures. I mean, I'm very clear when I'm out and about and I'm raising awareness that actually you can come to us about anything. You know, I don't want people sat there worrying. I don't want people sat there worrying, well, actually, I've got an issue, but can I go to them? You know, and I always say, come to us, we can thrash it out, we can decide whether we're going to escalate it through our escalation routes, or whether we're going to signpost you. You know, I can signpost you as well. You know, so it's a broad range. Again, in the pandemic, what we've really seen is that kind of health and well-being themes of coming through as well. What we have seen at SATH as well is at least once a week, we're getting someone who's coming to us, we sort of thrash it out, and there's absolutely no need for us to escalate it. And they go away, say thank you very much, and they go and deal with it themselves. And there's been real success with that, sort of empowering people to be able to take it into their own hands as well.
Really useful. So a whole wide range of issues come across your desks or virtual desks, depending on where you're based.
Absolutely.
So Celina, then, just taking that forward, can you take us through, on a very practical level, what steps do you go through as a guardian when somebody brings you an issue, and how, if people are wondering how you're going to respond to them, just take us through what you would do to support them. Yeah,
thank you, Sarah. So, I mean, if I just think of kind of examples, I mean, it depends. First of all, is the way people will contact me, whether it's going to be an email, maybe like, can I just speak to you, or they will be calling. And sometimes actually depend on the level of how people feel safe to speak up. Some people will say, I don't want to speak over the phone. I don't want to email either. I want to see you face to face. So then I just take accountability over how do this person wants to raise their issues, whether if it's a face-to-face, and I usually respond very quickly on the matters. And then when we meet, is usually about introduction, who I am, who they are, where do they work. And then I usually go about, I call it contracting, but it's actually about the issues of the confidentiality. So explaining to colleague that this is a confidential if it's anonymously, or kind of going through all of the, I would say maybe the process whereby we're supposed to say that at one point, this is a confidential and anonymously, but at one point, if there's any safeguarding issue, this may need to be escalated. And then I need to ask the expectation, because that's very important, because sometimes people want to air out and say, I'm going to deal with this, but I've aired it out. And so my question is, what is the outcome they are expecting? Do they want me to take it on and support them, or do they want? So that's I need to clarify that. And then after that, then I'm thinking about, okay, which platform does this issue sits at? Is it about the training? Is it about the leadership? Is it about the management? Is it about the colleague? Is it about the patient? Then signposting whatever support platform is there. So I usually work hand to hand with that, because I belong in people team. This is HR. So I am aware of the business partners, the health at work, and all sort of things. So I will signpost, and I will be kind of in conversation with the person and the place that I am signing post to them to be supported. And I do kind of sometimes, like you are asking, maybe you're emailing, you leave it a time for people to respond. And then I go back to the person and I say, okay, now we have got this response. Where do we go from here? How do you want? So supporting from point A to the last point, in terms of sometimes people will say, oh, no, maybe it goes to investigation. So then you will be informed that this case now has gone into the investigation. So I'm not involved in the investigation matters or anything, but I will be kind of being they will let me aware of what's happening, what stage. And sometimes, especially during the pandemic, where some of the cases took some time, the colleague will be coming back to me and say, oh, I haven't had. And then to me, it's about actually ensuring that the people who have taken the case, whether it's a ERAS team, maybe they are making regular conversation and communication with the person where they are at. And then linking the colleague with the networks, because there's a staff network and these are very supportive platforms, and I will encourage anyone in this call to really utilize them. So I will link with the network chairs and say this is another support. And then I call something like check-in. So even if after the case the issue has closed, I will wait some time and I'll call the person and say, how are you? But then in the midst of this, I'm much aware of the health at work. And this is like a platform where they can get help, whether it's psychological help, or whether sometimes, because some people will actually become being on sick leave because of the matter. So I usually link with health at work and say, okay, what are we supporting? How are we supporting this person? And I think out of all of this, there's always that learning point. What do we learn from this? And how can we take this learning forward? And how can we put these themes and saying this is what's happened and this is how we're learning, and how it is mostly underpinning by the culture, and just kind of is a continuously process. I don't know if I've answered your question correctly.
You have, very comprehensively. So responding to the individual, your role in tracking, reporting back, not intervening, but actually signposting and being clear and constantly clarifying those sort of expectations on both sides really came through very strongly in that. So Firstly, before I move on to the next question, so I've just noticed that lots and lots of people have just jumped into the session in the last couple of minutes. So we are, just to let you know, if you've just joined, that we are recording this session so we can share it afterwards. It would help us enormously if you can keep both your microphone and your camera off, so that we can share the bandwidth amongst the panelists, and we're able to record it as well. So thank you all very much. So you mentioned, Celina, the importance of confidentiality as part of the process, and the trust that people have to have in the guardians when they talk to you about issues. So I'd like to ask all three of you about confidentiality and anonymity and the role that they play in raising issues and in the confidence that people have in you as guardians. Can you tell us about your approach to it, and in particular highlight occasions where actually you have a responsibility to disclose information and how you handle those? So I think this time around, Helen, if we can start with you, and then we'll get others to add.
Yeah, so thanks, Sarah. So in terms of disclosing information, then absolutely, if it's a patient safety issue, that's just, you know, across the board, and I think that's very clear, and we would have those conversations. In terms of confidentiality and anonymity, as a trust, we get an enormous amount of concerns coming through. We're on for, I think it'll be 25%. So looking at last year, we had 300 concerns come through. I think 4 of those are actually truly anonymous. So, and I also think as well, when people come to, I know I certainly have a number of conversations with people, and I don't know about Celina and Joyful, where they come, and so obviously I know exactly who they are, but they think they are coming anonymously, and we have to have a discussion about what anonymous is. And when I'm doing a lot of my awareness raising sessions, I do talk about that difference between anonymity and confidentiality. So in terms of anonymity, and me and my team have spoken about this a number of times. There's been suggestions about putting sort of those, you know, those boxes out, those, finding anonymous, definite anonymous pathways where we are encouraging people to report anonymously. My approach to that at this point at our trust, and where we are, because we have so many people speaking up who are not doing it truly anonymously, then I'm not sure that I really want to encourage that at this time, because I think this is really healthy that people are coming forward. And ultimately what we do want to do is encourage a culture where speaking up is just business as usual. So I think in terms of those definite anonymous routes and encouragement, you have to be very careful about it. And I think it's, you know, one size does not fit all. So that's certainly my approach here at SAF at the moment. Who knows if that will change, because it's certainly discussions that we have from time to time.
Thanks, Helen. Joyful, do you want to add to that?
Thank you, Helen and Sarah. Because with me, I'll sort of like look from a perspective where you're not sort of like patient faced, because I'm looking from a staff perspective. In our organization, we don't have a lot of face-to-face contact with patients. So the way we've looked at how staff can come to us, for staff to be able to come to us in a confidential way or to be open, it's about having that staff having trust with the guardian. And that's something which is built with how either we present ourselves as guardian to staff, because somebody has to trust you to be able to come and speak up to us. So we've offered the options to come openly, where we know who is the person, and they're happy for us to share their name, their identity when we signpost the case. Or we've used the other option of coming confidential, where as guardians, we know the individual, we know who they are, but when it comes to raising their concern to the next level, we withhold the individual's details. all we just focus on is the concern, because that's what we tell them, that the most important thing is the concern which is being raised, and that is what needs to be heard, and that's what needs to be looked into, not to focus into who said what are they saying. It's more of what is being said. That's the most important message. When staff or individuals decide to use the anonymous route, this is where we sort of highlight the challenges it is for us as guardians, because we won't be able to know who they are. And if we've got any other questions we've got regarding the concerns, we haven't got anywhere to go back to. Or if we need to feedback to say this is how this concern has been raised, we don't know where to go. However, we still give staff the options to use that route until they feel comfortable or they feel they can trust us as guardians. So that's how we use the approaches. We look at it within our organization. I'll pass it back to Sarah. Thank you.
Thanks, Joyful. And Celina, I could see you furiously agreeing with your colleagues there. Do you want to add something?
Yeah, I think they've said quite all of it. We do have a working confidence platform whereby people can raise concerns anonymously, and usually you can type back and having communication with the person with whom you're not aware who this person is. And even though yes, you do encourage that okay, if you want to have a meeting outside of this platform, yes, but I think this underpin the culture, and also it's about our differences. I mean, sometimes really you can feel that people just do not want to be known, and I think just that even though that we would like everyone to come out and raise concern, but we're just respecting that platform, because you're actually thankful that someone has actually raised a concern, because at least they have raised a concern. And I definitely agree with Joyful. Say something about trust, because even this, the confidentiality matter, and yes, you will take the issue and say this is an issue in this area, even though you're not naming the people first. There's that when people are reaching you, this about them trusting you, your impartiality, and that is very crucial. Once they have formed that, okay, I definitely, that's you seem that things to actually move quite a lot. There were teams that in which when I found them, they didn't speak up before, and until that you establish that trust, then they are actually opening it up more and more. But sometimes you have cases whereby people, then they need to be moved from the area of where they're working to another area because of the issues. And at that point, then, because you will have to involve the team whereby looking where they can deploy this person and things. So at that point, some names may be coming out, but to very few people who should be involved, not like to the majority of them. But definitely these two things are underpinning your impartiality as a freedom to speak up guardian, and the trust that people have with you.
That's great, thanks. And there's a question in the chat about the platform, and thank you very much to colleagues for putting the link in the chat to Working Confidence. Helen, you wanted to add something.
I did. I just think, you know, what Joyful and then Celina reiterated about trust is it's the absolute key to this, isn't it? You know, and I think at our trust we have the privilege of being able to get out there and walk around and you know, just visit teams all the time, you know, and we are relentless in making sure that we are seen, that we are visible, and that we are giving that, you know, really giving that message out there. And I think that's really why, even though we've got huge amounts of concerns coming through, that we have low anonymity figures.
Thank you very much. So that theme that a couple of you referred to there about the importance of establishing the confidence, but then the next phase of sort of normalizing the speaking up process is a theme that we'll be returning to towards the end of the conversation today. But I think the next area that I would really like to hear from you about is just about the how the pandemic has changed the nature of both the kind of issues that people are bringing to you and the volume of reports that you're dealing with. So could you say something about this this part of the role, and what have you seen more or less of during the pandemic? And Joyful, if we could start with you first this time round.
Thank you, Sarah. For me, because like I've mentioned before, that I'm in a non-patient contact organization, it's been a bit different, the concerns which come to us. And at the moment, our numbers of sort of like concerns being raised, they're not as high as one would expect, it's just quite a bit, slightly a bit of a different angle compared to my colleagues, Celina and Helen. So I will have to either pass this to them because I won't be able to provide you with a better response in terms of what they have, how the pandemic is sort of like affected, because most of my colleagues, we're all home-based. That's how we have been prior to. We did not start working from home because of the pandemic. No, that's how the organization operates. So the only things, it's more of where we've had to stop doing any face-to-face contact with the trust, where everything is transferred virtually. So all our contacts are virtual, where we're seeing our colleagues and where we're just having check-in sessions, and then we've increased our staff well-being sessions. Everything is now online, so it's more where we're just waiting to be able to go back to being able to visit and meet people meet staff in their organizations. So I'll have to pass this to Helen and Celina.
So Celina, was it very, very different for you?
Considering the fact that I started in the midst of pandemic as well, so I couldn't do so much comparison. But yes, I mean the theme, the bullying and harassment. That's more of the theme we have seen that we have, and when you triangulate the data, you see it's the same theme comes from the staff survey as well. But at the same time. When you have other supportive mechanisms, so to me, the staff networks, they are there, and sometimes kind of it's almost like they act as a small buffer because they take some of the issues as well. Some people goes to the end, but I think that as an organization as a whole, what the trust has done is to try and address this the theme. So we're talking about let's say bullying and harassment. So there's this like a bite-sized learning whereby people can join in and there's kind of team talks and things to actually try to address, because you know, this is a theme, but if you are addressing maybe in one way or another, you may actually almost like trying to prevent an issue kind of emerge, because you are proactively addressing that issue before it emerged. But in terms of a volume, probably a little bit, I wouldn't say a big margin, but the themes are very predominantly there's a bullying and harassment. That's a theme. That's yeah.
Thanks. And Helen, how about your experience?
So at this trust, we had a rise on last year of in 2021, rise in the previous year of over 200% on our concerns. That was not just the pandemic. I think that is because of the awareness raising and that visibility of the gardens have been very, very proactive. But nevertheless, the pandemic, it played a significant issue in that. I think cases nationally rose by about 35%. So as you can see, yeah, we're I don't want to say outlier, because I think this is really positive. I think this is really positive stuff. The big theme for me is that health and well-being element of it. We really saw a lot of that coming through to us, you know, doing a lot of signposting of that, and again those kind of safe staffing numbers as well. So it was kind of almost it was a patient safety, but also about staff safety, how they felt, how they weren't able to give the care that they perhaps wanted to, and how they were worried for their pins, you know, and so that was a big theme for us. Yeah, one that really came through.
So thinking about what you've just said there about pressure. So the context for people, certainly those working in patient-facing roles, with the backlog that everybody talks about in public, the well-known staff shortages, what are your predictions about the types of issues that you're going to see coming through over the next year?
I think so. For me, what we noticed was that it was about, as I said, about safe staffing and about those staffing numbers on the wards up until, I think it was July this year. Our last one of those had been in January, and that had been a consistent theme. So it really died down. Now we're starting to see that coming up again, you know, as we're getting this third wave, as people are isolating, as people, you know, so I think that will continue. I think we're going to see the well-being stuff continue as well. Actually, once again, well-being stuff kind of came down a little bit. What you'll start to see now is, and we will see, is it going up again. In fact, we've been having conversations about, so as I've said before, you know, we get out there, we walk the wards, we walk the, you know, we see the teams are out on the floor. And when you go onto those wards, you know, we go in, we check in, and people say, how are you doing? You know what, sometimes it seems really inappropriate to say that, because you can see exactly how they're doing, you can see exactly what's going on. So I think for us, what we're discussing, and I put it to some of our senior nurses, our leaders, the other day, was that once Speak Up Month is over, what we'll start to do is look for safe spaces. We'll start to offer safe spaces at shift handover times, where the guardians or the ambassadors can be there at you know, in a prescriptive room at a prescriptive time, and people know they can come. And again, it's this kind of organic nature of freedom to speak up. So it's that extra pair of arms around our guys, you know. So for me, it's about freedom to speak up is about being able to respond to, you know, what are the needs at the moment, what do our guys need, what do our patients need. And for me, that's the beauty of it. So to answer your question, health and well-being, and those staffing numbers as well.
Thanks, Helen. Joyful, you've got something to add.
Thank you, Sarah and Helen. Just to add on to what Helen has just mentioned regarding staffing, because that's something which within our organization, we've started to notice how the staffing levels are having an impact, because we rely on the organizations for us to be able to conduct or to complete our investigations. We rely on the trust or the staff to provide us with information. So we are starting to notice some delays, or where in the past we would request some records and we will get them like within 2 days, or they'll come in instantly. But at the moment, we're starting to see a bit of a massive delay in the message which is coming across, not just from one individual trust, across most of the trusts we work. They're all just saying we haven't got enough staff, or either people are isolating, or somebody has gone off sick, where we can see the effects of the pandemic, how it's also not just impacting within the trust, it's also impacting on us as well, because now it means the investigations are going not to meet their deadline, they're going to be delayed. And that's something which we are picking up. And I just thought, let me just add on to what Helen has just added. Thank you.
Thanks, Joyful. And Celina, is your expectation the same?
It is absolutely the widespread staff shortage. I think this is what probably keep most NHS leaders awake at night. That's definitely huge pressure. But the well-being issue, absolutely, Helen, you are on the money there. It is, yeah, that is an issue as well. And this is almost like there was a period in just around summer whereby we were supposed to like rest and restart. But when you're having conversation with staff, they say, we didn't see that. It was supposed to really be rest and restart. But somehow it just passed just like that. So I think it's almost like still carrying that fatigue, moving to the winter period. And what the organization is actually doing right now for Eastern North Arts is actually to emphasize on having a rest, take care of yourself, all of these well-being initiative. We've got Here For You, whereby the numbers that you can call, the time, let's have a, just this morning, actually, I have replied to 2 emails of different colleagues with whom they're like really feeling tired. And I say, if I'm passing around there, we're going to have a coffee for 5 minutes and forget about work. And just this morning. So I think that widespread fatigue, it's that's going to be something as well to watch out for.
It's really, really important point, isn't it? And it's one that we've been, as unions, we've been raising the sort of the need. You know, obviously there will be a real challenge and a will to get through the waiting lists, because we all understand the impact on people who are, you know, who are waiting in pain for treatment and diagnoses. But the impact on our people is just huge, and going into the, you know, the backlog management straight from the pandemic is going to take a toll on people, isn't it? So Helen, you wanted to add something. We've just lost your sound, Helen.
Just didn't unmute, Sarah, that's why. Yeah, I mean, the expectations on our people is just enormous, isn't it? And, you know, forget a pandemic, you already had an exhausted workforce, and you throw a pandemic on top of that, you know, and you know, and how do you recover? And then we've, as you say, that backlog, and, you know, if we're not careful, we're just setting up our next lot of patients, aren't we, really? Yeah.
Yeah. So no, you know, no let up in your workloads anytime soon as a result of the context. So you've we touched earlier on the role that guardians have in spreading the culture of speaking up, and I think you've all given some examples of how you and your organisations are trying to do that, and driving an increase in the, you know, in the numbers of people coming forward to bring issues to you. But could you just say something about the barriers that you think there are to creating a speaking up culture, you know, maybe reflecting the journey that you and your organisation have already been on, but, you know, what is still left to do? And maybe Celina, we can start with you this time. We've lost your sound.
Oh, there we are, back again. Yeah. So yeah, reflecting on previous experience dealing with the issue, I think when you hear from Collie, it's about that fear of repercussion, that being a victim of speaking up. And sometimes people will even give you an example of okay, we have seen this. They will give you a live example of a colleague who has spoken up and something kind of have happened to them. And it's almost like there's going to be obstacles, or other people have faced obstacles into their career progression, a bit of about being excluded because of speaking up. And sometimes a colleague will report like, oh, no action, or what's the point? Because sometimes, as Helen said, you walk around and you encourage people, please do speak up, and it'll be, what's the point? We have spoken up and nothing happened. So it's almost about just having some realistic examples to say, okay, this is an example whereby an issue was raised and this is how it was dealt with. So it's about actually encouraging with real examples, because sometimes, like I always say to myself, people are not stupid, and it's like you can really not go there with an empty hand to say just speak. What guarantee that do you have? So you have to have some sort of a real example of how issues are being dealt in an organization. And also the trust. We are going back to the trust again. Do they trust that you will take it forward? Do they trust that the management or leadership or whatever team that is will take it forward? And also the hierarchy. Sometimes it's about, oh, who am I dealing with? And sometimes you have like, oh, when someone is senior, people seems to think that when people are senior, maybe they cannot be challenged, or sometimes even some of the issue will be coming from senior people as well. And it's just all of these things are coming out. And recently, or maybe because of a pandemic and because of the Black Lives Matter movement, because of the inclusion and diversity, there also has been another issue which has been brought up, is about inclusion. So something about, oh, are we included? Are our voices being heard? So that's also has been another factor of the embedded in the culture of speaking up.
And Joyful, do you recognise that picture? Are there additional types of barriers within, you know, within the environment that you work in?
Thank you, Celina and Sarah. So those are some of the common barriers which Celina has highlighted. And I think my main thing, it's the fear of repercussion and the lack of feedback. That's something which sort of like staff feel there is no change. They don't see any change which is happening. They will say either if I speak up, nothing gets done. So as a guardian, this is where I feel like as the role of the guardian, it's not just about listening to concerns and signposting, because when you take it to the next level, it's quite important as well for me as a guardian to ask the person where you've taken to the next level to say, what are you going to do? I need a response to take back, and I'll be coming back to you either in 2 weeks or 3 weeks to know if this is progressing. I'm not expecting you to promise the staff that you're going to build them a castle. It doesn't work like that, but at least be more realistic, because that's where it all goes back to that being open and transparent. So if you are going to be an organization which is open and transparent, at least be clear to say, is this concern, how are you going to deal with this concern? We don't expect the response there and there, but at least we need something to take back. That way, hopefully, the staff might be able to trust the process and trust that speaking up, it works. Because at the moment, they feel it doesn't work because nothing, the culture hasn't changed.
That's really interesting. So Helen, can I get you to develop that point a bit? Thinking about, so if you as guardians have a really important role in reflecting back to the wider workforce that action can be taken and the culture can be improved as a result of speaking up. How do you get leaders in your organisations to pay attention to the concerns that are raised with you?
Tenacity. You keep knocking on that. You just keep knocking on those doors. And I have to say, so I've been in post 10 months at SAF, and knowing where SAF is, I was expecting a lot more resistance than what I've actually received with the amount of concerns that I've got. So for most part, I've been knocking on an open door. Having said that, what I've also had to do is give them some support, because sometimes leaders just do not know what to do with them. How do we deal with this? So it's also as well, it's that phrase that the Guardian's office talk about, that kind of growth, that growth mindset as well. So, getting that message across to leaders, actually, this is a really good thing that people are speaking up. It means that we can change something. It means that we can do something about this. Please don't take it personally. I mean, sometimes I have really lengthier conversations with management or leaders than I perhaps do with people coming to who've got concerns, because they're upset that people have come to us that they didn't go to them, or they've been really trying their best, and and they're stressed as well. So it's about looking after those guys as well. And when I'm speaking about it, I'm very clear that Freedom to Speak Up is for absolutely everyone. So it's the privilege of a board member to use to use Freedom to Speak Up as much as it is for an HCA or a reporter or whoever you are within that organisation. It's also by illustrating change as well. It's by thanking people, and it's just about getting people on your side. And it's about, it's really, Freedom to Speak Up is a movement. Culture change is a movement, and you have to illustrate that and demonstrate it. So that's what we do. We're pretty tenacious, and we're relentless. We're absolutely relentless with our message.
So Celina, anything from you on that point about reaction from leaders in your organisation?
I was smiling because Helen took my sentence out of me, the bit about please don't take it personally, because sometimes the conversation, this is how it needs to start. And definitely I do acknowledge sometimes people feel like, oh, why didn't they say so? Why was I not being informed? Why has he actually reached to you? And majority of cases people didn't just call up and say, Freedom to Speak Up, we have got an issue. They had started somewhere. So usually I find that I'm not the first point of call. And I think to me, sometimes it's about working collaborative with leaders, colleagues, managers to say, if we could just adjust this, or if we could just logically listen to this person and try to be on their shoes, we would have saved so many people's time, including mine, because some of the issue could have been actually sorted out again, rather than escalating to a point of I need to call a freedom to speak up guardian. But definitely I do agree with Ellen, because sometimes people say, oh, what am I going to do about this? And it's about supporting mechanism, not just for the person who's speaking up, but also for the leadership team as well, as in, okay, how collectively can we do this? Because regardless, to me, I think any issue of the speaking up, any issues in the organization, it's about our laundry. And I take part of it as well. So are we putting our laundry out there and say what are we doing? So it's about working together, because at the end of the day, it's those patients who are knocking on our door, and what kind of environment are we putting for them and ourselves to thrive and be there together. And very recently, I quote this from Michael West from King's, where he said, we need to be present with each other. And I think that's what we need to do.
So then picking up from those themes about making speaking up, and as you know, somebody's put a very powerful comment in the chat about, you know, just reflecting your points that you have to make speaking up normal for everybody. And your earlier point, Celina, about inclusion. Are there groups either based on occupation, location, people with protected characteristics? Are there groups within your trust that you don't hear from and we need to do a better job of reaching out to?
If I'm reflecting from my trust, I would say the dynamic has changed in terms of feedback I'm getting from colleagues, in terms of personally me, a person of color, being there, and a woman being there, had the freedom to speak up. It gave some people who did not have a voice to come forward. So it's probably a bonus, first of all. And I think second, there are those groups of so people who works in different shifts, to be honest with you, because sometimes until you meet with someone face to face and they say, oh, I wanted to write, but I was just thinking about it. But since I've seen you now, I have got an issue. So to me, it's about how do you reach people who are working on the weekend, who are doing night shifts. And also there are those people who have been contracted to work with us, but they are not actually necessarily being employers of a trust, as in maybe people who are coming to help with their cleaning services and things as such. How do you actually say that also their experience is being catered for? But more ever nowadays, we are relying on agency and people who are doing bank. And how do we get to hear their voices? So very nicely, one colleague from HR, he is actually trying to hear the voice of these people. And when he reached to me and he say, oh, what do you think the issues are? And I say, you know what, let's hear from the horse's mouth. Let's do a short survey and ask people who are predominantly just banking and doing agency work, how do they feel about being with us here? How do they feel? Because sometimes you may adjust something and actually encourage those people to apply and being a permanent member of the workforce, rather than just coming and going. So I think it's just wider. It's wider issues, but definitely the marginalized group, people with protected characteristics, ethnic minority. Sometimes those are groups that to be very mindful about on how do you reach out. Yeah, and that's why the staff network as well has been helpful.
I'm so pleased you raised those points about the indirect workforce, because often those groups are also missed out of organisational monitoring. So if you think about the progress that's been made to spread the workforce race equality standard, now the disability equality standard rolling out, those are metrics that don't actually get picked up. The staff survey, you know, often misses out groups that are indirectly employed. So people who are doing temporary work within the organisation or through a contract are, you know, they participate in the life of the organisation in so many different ways. And if we don't find a way to hear their voice in the workplace, we're really missing a trick, aren't we? Helen, is that something that you recognised as well?
Yes, it is. I mean, having said that, as an organisation, because the amount of concerns that we have coming through, my focus is on making sure action is taken. Make sure robust action is taken on those concerns and make sure it's actually, it's actually happening. And they are dealt with before we start to go out there to look for those voices. And when I say look for them, start to look at our data really in depth. One of the things that sort of early discussions as well is that we don't actually take the protected characteristic data because we were concerned about it identifying people. However, I had discussion with CQC and they're very keen for us to start doing it. So I think that's something that we can really look at. What we have done is taken direction, though, from the NGO, recognising about the contracted workers, about bank staff, our junior doctors. We are very engaged with our junior doctors. We are also incredibly engaged with our international nurses. We do an awful lot with them. Chankar, who's the FTSU Guardian, just want to give you a little shout there, Chan, because she does some brilliant work with those guys, making sure that they're they're included, that they have a voice. They're meeting with our director of nursing tomorrow. So yes, we absolutely recognise that, and but in terms of our piece of work and it being more robust, that is something that we need to look at more as a trust, and we do recognise that.
Thanks, Helen. Celina, do you want to come back in?
Yeah, just to add on to that, I do have a colleague who I work with, who is a ADNI admin. He's really great. Sean, if you're on the call, thank you. He so much when he goes around, not just about ADNI, he really so much put a voice out about the freedom to speak up, and during the induction as well. And just Helen, when she touched about the junior doctor, so there's a junior doctor forum in which we tap in as well. There's a international nursing forum in which we tapped in as well, and all of that actually to get the message out there and to say we are here. But more importantly, what Helen is saying is, what are we doing about the issue?
And Joyful, is there anything that you want to add just in terms of the challenge of spreading that speaking up message across a whole organisation, particularly in your case where you've got people not in the same physical location anymore?
Thanks, Sarah. I think for us, it's more where we've sort of like realized the importance of either having a virtual training, because there was a freedom to speak up training and e-learning, and we thought the best way to try to reach to the rest of the whole organization was having a virtual training, and where we had to even request all the staff to have their cameras on, because that's the only way they can get to see us and know, because that's myself and my colleague, Christian. So that's one way for us to reach the organization, and where we've just said we've got a virtual door open. They can come contact to us. Doesn't have to be about any concern, or even if to just come about, have a chat about a random thing. If our diaries are open, so where we've said to staff, have a look in our calendar. If there is a free slot, just pop in and pop anything. And if it's just to talk about the weather or what's happening in our world, different parts of the country, it's just another way to just talk to staff and just get them to just have a bit of a chit chat and have virtual coffee and biscuits. So it's those small little things which we've really tried to offer to staff as well.
If you're offering tea and biscuits, then you're definitely going to get takers, aren't you? So lots of really strong messages coming through from all of you, and just kind of summing up the ways that you've suggested that that Guardians can do this and just hear from the whole workforce. I think the things that I've taken is around using existing networks and routes. So you've talked about the staff networks that are already in place, the regular meetings and check-ins, so induction sessions, the new cohorts of people coming in, whether those are international nurses or junior doctors forums, using existing forums. I'd also probably add, try and use your trade union networks as well to try and spread the message. seeking out those that you're not hearing from. So I heard a lot about that from you. And, you know, Helen, your earlier examples of turning up on shifts and making yourselves available in the same way Joyful was, reporting about, just finding and creating a space where people have the expectation that your door is open, whether that's an actual or a virtual door. Some really, really powerful stuff in there. So thank you. So we're moving into the last 5 minutes of the session. So while we sort of round things up, I'd just like to hear from you about a message that you could give to everybody on the call. So any of us who work in or with the NHS in any way, what are the things that we can do to support the speaking up message, and just a couple of top tips from each of you. And Helen, maybe if I can come to you first.
I knew you were going to say that. You know what? It's not just about listening to people, it's about making sure people are heard, that you've absolutely heard what they have to say. You know what? It goes a long, long way. And communication, it's one of my hobby horses. Even if we've got nothing to tell people, just tell them, sorry, I haven't got an update for you, but keep in touch with them. I think that is the key. So if people have raised something, make sure that you've heard exactly what they have said. And if you're going away and you're doing something about it, or action, or you've escalated to someone else, keep in touch, keep feeding back, and keep communicating, keep them in the loop. That is so important and so powerful.
Thanks, Helen. Joyful.
Thank you, Sarah. I'm just going to sort of like share what we shared during our staff training regarding speaking up. We just said, when you speak up, it helps the organization to learn and improve, and it enhances their experience of workers and patients as well. And then at the same time, it gives leaders an insight into things that might not have been things they might not be aware of. So at times, you might think the leaders are aware of everything, but they might not be cited of some of these concerns. So it helps them to see that actually there is some gaps within the service. And speaking up is for everyone. And whether you are directly employed by the organization or the trust, or you're working as a volunteer, or you are working as an agency, it is almost like as if it's everybody's responsibility to speak up, because it helps to improve where we spend most of our life. We spend most of our life in time at work, so we need the environment to be a conducive working environment.
It's really interesting, isn't it? Because most people now are used to getting requests every time they make an internet purchase. You know, you're used to getting requests to review what you've bought. And, you know, every time you log off a virtual call, you fill in the little stars to say how your connection was. But we don't make that same translation into our work, and the importance of getting and giving feedback on a really regular basis. So I found what you had to say really, really interesting. Celina, anything from you on your top tips?
I think my top tip will be, and this is for everyone, I would say, yes, the leaders and managers need to pay attention, but it's for everyone. Let's make that safe space for people to speak up. Let's just make that safe space, because that will be very helpful. And for people who are speaking up, I'll say, be yourself. Just be authentic you.
Helen, you look as if you were wanting to add something.
No, I just really like what Celina had to say then, you know, just come and be yourself, just create that safe space. Thank you, Celina.
And what a wonderful way to round up an absolutely brilliant session. I'd just like to say, a massive thank you to all of you in the audience for your reflections in the chat, and hope you found it as interesting as I have. But to you three for your really powerful observations and reflections. Thank you so much for spending this time with us. I'm sure that not only on the session today, but as this is shared throughout Speak Up Month, it will be a really powerful tool. I think you've given everybody a really good flavour, not only of the role of the guardians in supporting individuals, but spreading that important lesson about the speaking up culture. It is for everybody, and hopefully your session today will contribute to that that wider culture sharing. So thank you all ever so much. Thank you to those of you who participated, and look forward to future sessions during Speak Up Month. Thank you all.
Thank you so much, Sarah.